Well, major changes are coming to women's health. All private insurance plans in the U.S. will now cover preventative services without a deductible or copay.
Not only will screenings be free, so will birth control pills, even the so-called morning after pill. Fox 59's Eva Pilgrim is live on the Northwest side to explain tonight. Eva?
Guys, the Fed's making a major move on this one, forcing insurance companies to cover women's preventative health. It's getting a lot of buzz because of the fact that birth control is cost-free to women with insurance under this plan. But there's a lot more to it than just that. It also covers several different types of screenings and counseling. But not everyone is excited about the new plan. It's something a lot of women are talking about.
And it'll cut down on women having a whole bunch of babies. I do know some people who forego certain exams just because they can't afford it, especially in this economy.
The Affordable Care Act says insurance companies won't be able to charge women a copay or deductible for certain preventative health services. That means well woman visits, screening for gestational diabetes, HPV DNA testing for women over 30, STD counseling, HIV screening and counseling, FDA-approved contraceptive methods, breastfeeding support, supplies and counseling, and domestic violence screening and counseling will all be free with insurance. While the screenings, tests, and contraceptives may be cost-free to the patient, the insurance companies will now have to pick up the tab, and that makes many worry.
Somebody has to pay for that, whether I pay for it as a woman or not. A lot of the other taxpayers are going to pay for it.
The idea of the plan, spend more up front, saves more on health care in the long term.
I think it will, in the long run, save us a fair amount of money.
Dr. Ferrara says the preventative health plan is the way to go.
We know that if we can prevent a disease from occurring or a problem from occurring, it's going to be better for the patient and less expensive for the system.
Women we spoke to today say it's an expensive choice for them right now. Chelsea says she's paying $70 a month for birth control, and she's glad to see her insurance will be covering that cost starting next August.
They don't pay for preventive care right now, and they need to start paying for it, because if they prevent stuff that happen, then other things will happen down the line. I think it's great because that will prevent some diseases, some cancers.
Now, the Affordable Care Act will go into effect with all of these services, not right away. It doesn't go into effect until August of 2012. On the Northwest side, Eva Pilgrim, Fox 59 News.